am Natalia from UNES Public Health Science Department. In this video, I would like to explain about mucormycosis. It is one of the examples of fungal disease. Mucormycosis is a serious but rare fungal infection caused by a group of molds called mucormycetes. Mucormycetes are present throughout the environment, particularly in soil and in association with decaying organic matter such as leaves, compost piles, and animal dung. They are more common in soil than in air, and in summer and fall than in winter or spring. Most people come in contact with microscopic fungal spores every day, so it's probably impossible to completely avoid coming in contact with mucormycetes. These fungi aren't harmful to most people. However, for people who have weakened immune systems, breathing in mucormycete spores can cause an infection in the lungs or sinuses, which can spread to other parts of the body. Several different types of fungi can cause mucormycosis. These fungi are called mucormycetes and belong to the scientific order Mucorales. The most common types that cause mucormycosis are Rhizopus species and Mucor species. There are 5 types of mucormycosis: Rhinocerebral Mucormycosis, Pulmonary Mucormycosis, Gastrointestinal Mucormycosis, Cutaneous Mucormycosis, and Disseminated Mucormycosis. Rhinocerebral mucormycosis is infection in the sinuses that can spread to the brain. This form of mucormycosis is most common in people with uncontrolled diabetes and in people who have had a kidney transplant. Rhinocerebral mucormycosis is usually severe and frequently fatal unless diagnosed early and treated aggressively. Necrotic lesions appear on the nasal mucosa or sometimes the palate. In pulmonary mucormycosis, it is the most common type of mucormycosis in people with cancer and in people who have had an organ transplant or a stem cell transplant. It resembles invasive aspergillosis. Pulmonary symptoms such as productive cough, high fever, and dyspnea are severe. Gastrointestinal mucormycosis is more common among young children than adults, especially premature and low birth weight infants less than 1 month of age, who have had antibiotics, surgery, or medications that lower the body's ability to fight germs and sickness. Symptoms of gastrointestinal mucormycosis include abdominal pain, nausea, vomiting, and gastrointestinal bleeding. Cutaneous mucormycosis occurs after the fungi enter the body through a break in the skin, such as after surgery, a burn, or other type of skin trauma. This is the most common form of mucormycosis among people who do not have weakened immune systems. Cutaneous mucormycosis can look like blisters or ulcers, and the infected area may turn black. Other symptoms include pain, warmth, excessive redness, or swelling around the wound. Disseminated mucormycosis occurs when the infection spreads through the bloodstream to affect another part of the body. The infection most commonly affects the brain, but also can affect other organs such as the spleen, heart, and skin. Typically occurs in people who are already sick from other medical conditions, so it can be difficult to know which symptoms are related to mucormycosis. Patients with disseminated infection in the brain can develop mental status changes or coma. Mucormycosis is rare, but is more common among people who have health problems or take medicines that lower the body's ability to fight germs and sickness. Certain groups of people are more likely to get mucormycosis, like those with diabetes, especially with diabetic ketoacidosis, cancer, organ transplant, stem cell transplant, neutropenia, long-term corticosteroid use, injection drug use, hemochromatosis, skin injury due to surgery, burns or wounds, premature and low birth weight infants. People get mucormycosis through contact with fungal spores in the environment. For example, the lung or sinus forms of infection can occur after someone inhales the spores from the air. A skin infection can occur after the fungus enters the skin through a scrape, burn, or other type of skin injury. The fungus tends to invade arteries. As a result, blood clots form in the arteries. Blood flow to tissues is blocked, and tissue dies. The fungus grows uncontrolled in the dead tissue, which becomes black. The surrounding area may bleed. Mucormycosis can spread between people or between people and animals. It's difficult to avoid breathing in fungal spores because the fungi that cause mucormycosis are common in the environment. There is no vaccine to prevent mucormycosis. For people who have weakened immune systems, there may be some ways to lower the chances of developing mucormycosis. Try to avoid areas with a lot of dust like construction or excavation sites. If you can't avoid these areas, wear an N95 respirator while you're there. Avoid direct contact with water-damaged buildings and flood water after hurricanes and natural disasters. Avoid activities that involve close contact to soil or dust. If this isn't possible, wear shoes, long pants, and a long-sleeved shirt when doing outdoor activities such as gardening, yard work, or visiting wooded areas. Wear gloves when handling materials such as soil, moss, or manure. Clean skin injuries well with soap and water, especially if they have been exposed to soil or dust to reduce the chances of developing a skin infection. If you are at high risk of developing mucormycosis, had an organ transplant or a stem cell transplant, your healthcare provider may prescribe medication to prevent mucormycosis and other mold infections. Healthcare providers consider medical history, symptoms, physical examinations, and laboratory tests when diagnosing mucormycosis. Healthcare providers who suspect mucormycosis in lungs or sinuses might collect a sample of fluid from the respiratory system to send to a laboratory. Healthcare provider may perform a tissue biopsy. Imaging tests such as a CT scan of lungs, sinuses, or other parts of the body is needed, depending on the location of the suspected infection. For the treatment, there are antifungal drugs, treatment of the underlying condition, and surgery to remove infected and dead tissue. Early diagnosis and treatment of mucormycosis are important to prevent death or to avoid extensive surgery, which often causes disfigurement. Thus, treatment is started as soon as this infection is diagnosed or suspected. Most people with mucormycosis or suspected mucormycosis are treated with high doses of the antifungal drug amphotericin B given intravenously. Isavuconazole taken by mouth or given intravenously is an alternative. Controlling the underlying condition is very important. For example, people with a low white blood cell count are given injections to increase their white blood cell count. People with uncontrolled diabetes are given insulin to lower blood sugar levels. Infected tissue, and especially dead tissue, must be removed by surgery. Mucormycosis is very serious. Even when as much infected and dead tissue as possible is removed and antifungal drugs are used appropriately, many people with this infection die. So that's all my explanation about mucormycosis. I hope you are staying healthy and happy. Thank you.